Good afternoon. Welcome again to our webinar series entitled Frontline Report, Autoimmune Liver Disease and the Pandemic. This series of webinars are made available via collaboration between the Autoimmune Hepatitis Association and the Center for Autoimmune Liver Disease in Cincinnati Children's Hospital. My name is Craig Lammert. I'm the Executive Director for the Autoimmune Hepatitis Association, and I am once again excited to help host a second webinar in our series entitled Coping with the Crisis. Quickly, a disclosure from the Autoimmune Hepatitis Association. This webinar series does not replace your primary physician, gastroenterologist, or hepatologist. Thus, we cannot diagnose, treat, or manage symptoms associated with AIH. But before we dig into the focus of this webinar, I would like to reintroduce Dr. Aaron Ermel. He is an assistant professor of clinical medicine at the Indiana University School of Medicine in the Division of Infectious Diseases. We asked Dr. Ermel back again this week to give us a few quick updates on the COVID-19 pandemic relevant to autoimmune liver disease patients through the eyes of an infectious disease expert. Thank you for being with us again, Dr. Ermel. We appreciate you being here.
Thank you.
So, Dr. Ermel, just a few brief comments and maybe your sentiment. How are we doing as a country to flatten the curve, and are we really doing any good?
So it's a little hard to tell at this point, even though we've had a number of days. I think the estimate's around 5 to 6 days that we've seen kind of a plateauing of the number of cases. If you look at kind of the rate of our case ascertainment, it has decreased over time. You know, what I think people have seen over the news, which has been discouraging, is us kind of reaching that 20,000 death mark there, but our case fatality rate is similar to other countries. So try and take that number with a grain of salt. But if you go to websites such as like Johns Hopkins data tables and their dashboards, and you just simply follow that curve, we're starting to see it kind of finally plateau and flatten out over the last few days. And I think that's kind of a nice national trend. It is going to be different for various parts of the country, but this is what the majority of reporting centers are seeing.
So it sounds like good news, at least for now. How about some of our members had some questions after our last webinar, and maybe we could highlight some of these pieces. One of the questions is, we still are identifying the immunosuppressed and maybe chronic liver disease as a potential high-risk group. I think a little bit more information is needed. Are we seeing guidelines loosened to get these patients tested among different states or around the country as well?
Right. I mean, I think the easiest way to look at it is from the national guidelines that have been kind of at the end of March were there's another iteration of these guidelines, and it does place the immunosuppressed populations in a higher tier than some of our other populations, but it still focuses on symptomatic individuals. So it's not that now just because you have this underlying condition, you can walk in and get a test and you'd be prioritized. You'd be prioritized if you were symptomatic and you had an underlying condition. So it's been slightly liberalized, but not to the degree of anyone can just walk in. And that's still due to some issues with the availability of testing reagents and supplies.
Understand. A few other things, and a lot of things come up with our members about vaccines. And we know vaccines are coming, maybe earliest I've heard is 6 months up to a year and a half, maybe longer. You know, our immunosuppressed patients worry about this type of stuff, particularly the type of vaccine, the live versus an activated. Do we know what the type of vaccine this will be?
So we do not. As I mentioned in the last webinar, there was one that entered an early phase clinical trial, which was actually a DNA-based vaccine. So this is not a live vaccine. This kind of tricks your bodies, or it's an mRNA-based rather, tricks your body to actually produce the protein and then produce the immune response. And so this isn't like a live virus that's being injected into your body. I don't know of any live vaccine candidates right now. All of them are actually some form of killed or one of these DNA or mRNA-based vaccines. So that's actually a good thing for those who are immunosuppressed, because it doesn't mean that then it would be necessarily contraindicated in your case, because it wouldn't be a live product. We don't know enough about these to see what the immune response would be in people who are on immunosuppressants. I think we're too far out from even a functional vaccine to even get that far and to assess that type of efficacy.
Sure, and that makes sense. And I think along those same lines, the concern about patients that are on immunosuppression getting vaccines, as an ID doctor, do you worry about immunosuppressions blunting the development of a response to a vaccine?
Well, yes. I mean, there's some correlates you can see from other diseases. So as an ID doc, I give out tons of vaccines. And we know that, say, in my HIV population, even after we get them on treatment, the response to like a hepatitis B vaccine is, classically been known to be really low. So it is something we do worry about with these vaccines. I think what's encouraging is that there's not just the vaccines themselves, but what's put in with the vaccines, or what we call the adjuvants. So many people have heard of Shingrix, which is a shingles vaccine, which before all we had was a live vaccine, which we couldn't use in post-transplant and other patients. But with Shingrix coming out, it was a piece of the virus plus another chemical in there to actually stimulate the immune response. And it actually worked very well in transplant patients, especially in kidney transplants. So I think with some of that knowledge and being able to adapt that to maybe a coronavirus vaccine, we might see some improvement in the immune response in patients who are even on immunosuppressants or post-transplant.
Gotcha, and that makes sense too as well. A little bit of a moving away from that topic in terms of when social isolation and restrictions are loosened. I think a number of our members are concerned about going back to life, traveling again, or even sending our kids that have AIH or parents with AIH and their kids back to school. Any general statement or concerns or worries you could add?
Right. So that is a concern in the sense that each community is going to be slightly different because as the nation moves through and we see this first big wave kind of calm down, I think what we're going to see are going to be different case rates around the country. And so it will depend upon what your local community spread looks like. So that will be taken in advisement with the local health departments as well as your school systems. Many of the school systems are being very conservative as to when they are deciding to send people back. So, just saying no more classes for the semester. In fact, we're even reevaluating what we're going to do in the fall. So I think many of them are going to wait so that every child will be safe. And it's going to be hard to assess the population in general as to when anybody could go back. Travel is a completely different concern because not only do you have to worry about being stuck in that metal tube in the air with a bunch of other people, it's also where you're going. So then you have to look at what your destination is, and do you have really high case rates still in that area? So unless you're immune, or but especially for this population with immunosuppressants being an issue, you're going to have to think twice before actually traveling to, I guess, outside the U.S. definitely, even in certain places within the U.S. So you're going to have to wait until we actually stop seeing new cases develop for a period of time.
Sure, I think that's great advice. A few other questions, and I've had this come up in my own clinical practice with AIH patients testing positive for COVID-19. How long should people be quarantined after a positive test, particularly in lieu of, or in the setting of immunosuppression and some of the data we see with viral shedding as well?
Yeah, I mean, it's interesting. So the CDC actually just issued some guidelines in the immunosuppressed populations of what to do. They didn't go as far as to say that there's a definite timeline you have to follow. Right now, they're advocating for test-based removal of quarantine restrictions. So that means that you have to have 2 tests that are negative collected 24 hours apart after a period of time. So this is actually after you become afebrile for a period of 3 days without having to use anything like any fever-reducing products, and that your respiratory symptoms have also improved, and then they would encourage the testing. So if you have access to testing, and so now that we're in a slightly different place with testing than we were just a couple of weeks ago, and you're in that immunosuppressed population, you'll probably go get it from one of the larger hospitals. You're recommended to actually have the 2 tests, the 2 nasal swabs, collected 1 day apart. If you can't, you're waiting at least to see the resolution of the clinical symptoms. Some people are still recommending 14 days. you're correct in saying that if you look at other viruses like influenza, I mean, we treat that completely different in the hospital where we're looking at viral shedding to 21 days, and there's even some early work within SARS and even from the prior SARS epidemic saying that yes, you will shed longer. This is why they're really encouraging the test-based removal of quarantine restrictions.
Understand. On another note, after infection as well, what can we expect our immune reaction to be? And there's a lot of discussion about, is this going to be protective? And if it is protective, for how long? I know there's some old data from SARS that, again, was just a few years and then loss of immunity. Any thoughts or ideas about that?
Yeah, so it depends on how you look at immunity. So reinfection rate is incredibly low in these viruses. So I think once you have recovered, immunity is actually pretty long-lived if you look at just clinical reinfection rate. If immunity is tricky because there's two arms to this. So there's the antibody, which is probably the easiest thing to measure. And if you do look out a few years, you see both the protective antibody titers drop pretty quickly. And some of them are undetectable. Like there's small series that find that, you know, less than 10% of patients will still have detectable antibodies just a couple years later. But if you look at the other arm, which are these special types of T cells and things that are a different type of immunity, that actually looks like it might be lifelong. So there's studies that have looked at as far as 10 years, still seeing that patients have these T cell responses. So that's encouraging, suggesting that despite low undetectable antibodies, your body still remembers how to fight the virus, and that actually severe disease or even clinical reinfection is going to be incredibly low. So that's through natural infection. Unfortunately, we don't have great vaccine correlates because though people worked on vaccines, none of these ever made it to the market. You don't see people marketing SARS or MERS-CoV vaccines. So we don't have a lot of great data in humans as to how long like a vaccine would actually last. Understand.
Great. And just a few high-level questions, just briefly in our last 30 seconds. A member of ours said, I live alone. No one's coming, no one's leaving. Do I need to clean every surface in my house every day?
Yeah, no, you do not. So you're probably very low risk. Anyone who is really trying to practice the social distancing, I mean, the virus won't appear essentially from nowhere. There does have to be some contact. So I think having to really worry that much about cleaning every day, you don't. If you have visitors, which you shouldn't be right now anyway, then yes, you would want to disinfect afterwards. But no, you're safe if you're actually able to practice the quarantine and the social distancing appropriately.
Fantastic. And very last question is, a lot of thoughts on this on social media. Are immunosuppressed patients higher at a risk of catching this virus as opposed to someone that is not?
Right. So they're more likely to develop clinical disease based on what we know. Again, it's still early to look at some of these specialized populations, see how severe the disease is. There was, over the weekend, in trying to answer this question, actually found a report in actually through liver transplantation, looking at a report out of Italy, a very small report, but suggesting that they did not see necessarily worse outcomes in their patients who were post-transplant. It was still incredibly small, even though it came out of Italy in the middle of the worst portion of their epidemic. So I still would exercise caution. We still locally here are considering these patients to be, high risk for developing severe disease, but there may be some encouraging reports as this epidemic develops that, maybe that's not the case, that maybe they're on the same playing field as the rest of us when it comes to developing severe disease.
Great. Dr. Ermel, thank you for your time today. We really appreciate your thoughtful responses and your guidance during this time. We appreciate it. Thank you.
Thank you.
So let's transition to the focus of today's webinar. But first, I'd like to provide a brief background on this topic. Multiple studies have shown that autoimmune hepatitis patients more often have pronounced physical fatigue, anxiety, and depression than those without this disease. For instance, data suggest AIH patients are 5 times more likely to have significant feelings of depression and 2 times more likely to have symptoms of anxiety that impact quality of life. These symptoms, often correlating with each other, have been found to be just as problematic among pediatric patients with autoimmune liver diseases as in adults as well. No matter adult or pediatric, Research has shown that these symptoms play a huge role in reducing the quality of life among many patients with autoimmune liver diseases. In fact, the management of another connected symptom, stress, may be important in the management of autoimmune hepatitis as well. This bar graph shows the results of a small 2010 study comparing AIH patients who flared, these are cases in the black bars, over 4 years of follow-up, and AIH patients that did not flare, or the controls or white bars. And what we see is a much higher proportion of patients reporting at least moderate to major stress via a few study instruments during this period were more likely to have disease flares, manifesting as worsening symptoms or liver test abnormalities than those that responded low to mild stress levels. The AIHA has realized the importance of patients addressing these psychological factors, even when not addressed by their doctors. We have provided a hands-on acceptance and commitment therapy seminar to at least 30 participants at our last patient conference in 2019. And we're excited that we recently received a grant to develop a dedicated autoimmune liver disease sleep school to help train our members to get more and better rest. Unfortunately, with the COVID-19 pandemic, the world is relying on social distancing and quarantine to halt the physical spread of disease. These aggressive yet needed isolation tactics may produce further exacerbations in psychologic symptoms among many, and maybe even more so among those that suffered from these prior. Next, I want to introduce Erin Anderson, our next moderator. She is the Director of Programs and Advancement with the Autoimmune Hepatitis Association. Erin?
Thank you, Dr. Lammer. For the next segment of our webinar, we are thrilled to have Dr. Anne Mary Montero with us. Dr. Montero is an assistant professor of medicine at Indiana University School of Medicine, where she has worked as a clinical psychologist since 2007. She is an expert in health psychology and has a special interest in patients with digestive and liver diseases. She also has been a dedicated collaborator with the Autoimmune Hepatitis Association. At our very first patient conference in 2015, she taught our members about the importance of mindfulness as a strategy for coping with symptoms of autoimmune hepatitis. She is truly passionate about helping patients with chronic conditions. Dr. Montero, thank you for joining us and for being willing to answer questions that patients and family members have submitted.
Oh, it's my pleasure. Thank you so much, Erin and Dr. Lammer, for having me.
Thank you. We'll go ahead and jump right into the questions that our patients submitted. The first one, having a rare liver disease like autoimmune hepatitis is really stressful on its own, but navigating a chronic condition during a pandemic is even more challenging. What can patients do to ease the anxiety they may be experiencing at this time?
Well, as a medical psychologist, I'm honored to meet patients at exactly this intersection where we are encountering medical as well as, of course, other baseline psychosocial stress, what people are having day to day long before COVID-19 was a household name. So I would first and foremost respond directly with empathy that this is an enormously understandable and common experience to have worry or stress as a reaction. And as Dr. Lammer pointed out with his slides, and I appreciated the Where's Waldo graphic, having circumstances that are predisposing us to other challenges, including direct research around autoimmune hepatitis predisposing folks to both depression and anxiety is important to bear in mind. I work with liver patients as well as GI patients, and the study that I appreciate being able to cite most often is just one brief statistic, is folks who are presenting for medical care who have any type of GI or abdominal symptoms have a whopping 50 to 94% overlap with depression and anxiety. That means folks who are coming for medical care, almost at least half, sometimes almost all of them, will qualify for also diagnoses of depression or anxiety. So this is widely normalized, and especially now in these uncertain times, of course, it's understandable to have greater concerns. However, there's lots that's within our control. As psychologists, we think through something, a lens that we call the biopsychosocial model. It's just a fancy way of describing the human experience through something like a triangle. If you think of physical experience in one corner, or medical contributors, mental and emotional in the top corner, and then social, our community, our own behavioral response at the other end. I like to use something called the 3 R's: routine, reframe, and renew, to tap each of those corners. Physical routine, behavioral routine that we can keep up, consistent activity, soothes our brain, letting us know what to expect and helping meet our needs through things like exercise and sleep. Even to a very mild degree, effort in those arenas can make a huge difference in our well-being. Reframing is kind of like a camera lens, shifting how you're seeing something. And while stress, probably most people think of that as a negative, there's actually a fantastic study that shows stress can be all in how we perceive it. So if you believe stress effects are negative, you will likely have physical effects more so from them. And then lastly, in terms of renewing, ways that we can take active, conscious attention for our self-care can make a huge difference to minimizing anxiety even during these stressful times.
Great. Something our members are especially anxious over sometimes is going out in public for work or to run essential errands. Do you have any tips to help patients feel less stressed while they're out and about in public?
For sure. It is really scary to see people in masks, isn't it? It's a visual reminder this is an unprecedented experience. And likely everyone is feeling somewhat the same. Remembering compassion, that we're all like similarly behind the masks, as so many of the TV ads remind us, in this together. However, behaviorally, it's much harder to read people when you can't see their full faces. And when I'm reminded of FBI studies that show that eye contact, if you see someone's genuinely smiling, you'll see crinkles around their eyes. So even with the masks, you can still tell, with eye contact and with some degree of facial expression, what people are experiencing. We also know from social psychology literature that when we are more anonymous, we are sometimes less inhibited. So some of the social distancing is also self-protective, within reason. People want to keep their distance medically, but also, be mindful and make a socially appropriate eye contact where you can, to kind of gauge where someone else is at. Just in kind of asking, and the few times I've been out gowned and masked or gloved and masked, I've asked store clerks about how people are behaving, and the comments have ranged toward the extremes, that some folks are being extra kind to go out of their way, and other folks are behaving as if they're very stressed. So I think just anticipating that other people are likely feeling that same stress and managing that compassionately as we would with a child who was hurt or a friend in need, both with ourselves and others, is a helpful way to reframe that.
Thank you. Some of our patients and family members are struggling to sleep well. Do you have any suggestions for ways to promote better sleep?
Absolutely. We could do a whole hour just on this. Sleep is so essential, and we know from our literature, this is a huge focus in CBT because the effect size is so huge. There's kind of a paradox to sleep though, right? The more you try for it, sometimes the more elusive it is. You have to be both at once ready for it and then sufficiently relaxed to allow it to occur. But some psychologically savvy strategies can help us kind of maximize what we can do to contribute to that being good. Something called sleep hygiene. This is just kind of a fancy way of describing two main principles. We want to have kind of a curve of increased activity or arousal during the day to allow for natural calming and rest at night. And with that, having a downward slope of stimulus or stress as the day goes on. So not exercising in the evening, and certainly not looking at email or things that would evoke a stress response. With COVID-19, probably we want to do some scheduled awareness of outside information, like watching the news. For example, in my home, I'll see the 6 o'clock and 6:30 national news, and then I'll limit my viewing of the intake of that information so that that's not ongoing throughout the evening. It's easy to kind of have that bleed into our lives. So limiting appropriate, keeping some contact with reality, but not having that bleed into all of our evening time. And then we want to have conditioned routine to help our bodies be cued for sleep. So the more that you can do things in a regular order, a consistent flow night after night, so that your body is rehearsed and ready when your head hits the pillow, that you can go ahead and allow, within 15, 20 minutes or so, allow your body to rest on into sleep. And if that's not successful, if you find that after that time you're still awake, or you wake up in the middle of the night and things are on your mind, you want to help your body get out of that position so that you don't accidentally associate that restless, distressed but not sleeping feeling with being in the bed. So help yourself get up and do something that's distracting but not stimulating. Certainly no blue light screens. Don't get on your computer or Facebook, but let yourself, read, maybe have some protein to eat, and then try again to sleep in a bit and see if that's helpful to get you successfully on to rest.
Great. You mentioned routine a number of times in this webinar so far, and how that's so important. And that's something that patients have actually emailed in about, that they're struggling with this drastic change in their daily routines and not being able to go places and see friends. How can we promote connectedness and community during this time of isolation and quarantine?
What a superb question. And it's ironic, as I was preparing for the talk, MIT just released a study on Friday comparing the hunger drives that we experience in our brains to the experience of social distancing. So in other words, having the loss of social connection can feel as powerful to our brains as loss of food. So this is a super powerful effect. We know we've always thought with the Maslow's hierarchy, that triangle with the base needs of food, clothing, and shelter, survival stuff on the bottom. We're finding that social connection is also super important. But as I mentioned earlier, the power is in the perception. So how you think about this has an enormous impact on what you're doing. So virtual, thank technology, we now have tremendous access. Even without the medical risk of being in person, breathing the same space, we have the opportunity to connect with folks just right now as we're doing virtually on this seminar. I have a virtual family dinner date this week. We have some friends we were going to have over that got deferred, and now we're going to all meet and have what we would have had, but with cameras instead of being in person. Even if you're not able to connect or technology's not your thing, thinking about folks, and even something as old-fashioned as letter writing, we have great literature to support putting it in writing. The act of manually writing things out helps our brain process things differently. And where our attention goes, so goes our heart. So if you can focus on people that you care about, whether that's folks you literally know, or now with the World Wide Web having such an expanded definition of community, we can consider lots of ways technologically and in real time to engage ourselves that gives us still that social support benefit, but without the medical risk for the time being.
Great. We all know exercise is really important, but going outside, especially in densely populated cities, can be a real source of anxiety. In addition, just finding motivation to exercise during the pandemic can be difficult. Any tips for dealing with that?
For sure, yeah. Exercise is hard for lots of us in the best of times. And so during times we're more stressed, it's easy to feel a loss of motivation or looking for other ways that our brains can kind of, we're essentially just craving reward. And that's similar to those food and hunger drives I mentioned earlier. So there are lots of ways to provide reward. I think about kind of two principles here. One is practically, like, there are lots of ways to get creative. I've seen folks online and even some commercials where people are getting creative at home, like lifting their kids on top of their backs with push-ups or using everyday objects in their households. Gentle walking and stretching can have significant physical and mental benefits. So anxiety reduction with even doing some stretching or mindfulness activities can begin to make a difference. And the second principle I just kind of gently put on the table is, I remember from high school, the physics principle of startup energy. That is, going from 0 to 1 takes more effort than it does to go from 1 to a big number. So just getting started is often a really big barrier for lots of us. And I would add, just from your question, Erin, having the consideration of the option, even thinking about exercising. If we were working together, I'd say, hey, congratulations, you're already on your way, because you have introduced that as a behavioral option for yourself. Considering it is already partly along the way. So you can use some mental tricks to get yourself engaged, and then you've got some momentum going. And I usually challenge patients to just identify something that feels already within reach that they could do physically, like for example, 10 minutes of walking. Most people feel like they can do something for 10 minutes. They can tolerate something for 10 minutes. If they just begin with that and then add on maybe 3 or 5 minutes every 3 days, they could get up to what are typical physician recommended guidelines within a month without much sweat and just gradually moving the dial. And lastly, I would add some motivation along with that, adding other pleasurable reward, like for example, having music that you enjoy, or what reminds you of what was really positive, upbeat time in your life. Putting that on with some headphones, reminding yourself that you're taking control and taking breaks. And by the way, exhibiting commitment to a routine, back to that brain soothing, that you're holding on to a flow despite all the disruption we've had in these times, that can have a really positive benefit and make exercise much more accessible than it might feel like from sitting on the couch.
Those are some great suggestions, thank you. If patients or family members think could benefit from therapy, what are some other options for virtual therapy during the pandemic and even after it's on?
Oh, that's such an excellent point. Just considering therapy, I think, is again already a real positive, and certainly there are resources online to find folks like Talkspace or MD Live, This Way Out. There are lots of good resources to find people. But in addition to that, I think about a couple other places that you can go just to experiment with ways to engage in self-care or see what those techniques feel like. We've got super data behind mindfulness and meditation. I think the word meditation itself sparks a whole lot of like, oh, you know, that's not for me, or it evokes a certain image. But actually, it's just bringing awareness without judgment to the present moment. And that could be from something as simple as like, while you're doing the dishes, concentrating on the literal behaviors of your hands moving, or while you're folding laundry. Or it can be more focused and intentional with something like classical music while you're imagining a successful or peaceful scene. So there are lots of great resources online, mindful.org, or the grandfather of the modern movement, John Kabat-Zinn, has some excellent, I usually show patients something called the mindfulness meditation taster. It's just 5 minutes that helps you follow along his thought process that tunes into the 5 senses. And it's amazingly engaging. You'd think, oh, this might be really boring. We're talking about what you can hear. And the impression is it slows down, but it's actually quite fascinating. And you'll see everyone along the room with him following along and closing their eyes. And it's a very, I think, helpful, quick snippet of how to engage with that. So I've got lots of colleagues with great blogs. Dr. Lori Kiefer, Mount Sinai Medical School in New York has some great tips on coping. But I would just add, and of course, exercise, by the way, there's loads of places online to coach you along with how to engage movement. But I would just circle back to the idea of any consideration of those ways to help yourself online is already a positive, and to give yourself credit for the effort and intention to look at self-care.
Great. Last question, we want to focus on caregivers a little bit. What can they do to help their friends and family members with chronic conditions during this pandemic?
Thank you for bringing that up. I was honored to speak to the AIHA before about caregiving. It is so close to my heart. Caregivers are often kind of a silent majority behind the folks who have the overt medical experience, but the caregivers experience a great deal of stress themselves. And I think it's extra challenging, as they can often feel kind of in the passenger seat along the ride of the experience, together with their loved one who's having the medical symptoms. And that can be very challenging from a number of standpoints. And we know that there are psychological and even medical risks that go along with that. However, we also have great data to show that as people provide caregiving, that can also provide effective psychological and physical protection, even conferring immune benefits to patients who provide care. The perception is the key difference. So where caregiving can tip over into experiences that feel too heavy, or the psychological takeaway outweighs the feeling of giver's joy, that can be something to pay attention to. So I'd encourage them to be mindful of what they're experiencing themselves, not just focus on the overt or what we would call identified patient, but bearing in mind that both folks in the car, so to speak, deserve care. Keeping up routine, physical movement, and ways to meet their own needs psychologically are very important, and again, deserve time and attention alongside the patient who's also deservedly needing support with medical experience.
Great. Dr. Montero, thank you for being here today. Your tips and suggestions have been invaluable, and I know patients are really grateful for your suggestions, especially during these extra challenging times. So thank you again.
It's my honor. Thank you for having me.
Thank you. I'll turn it back over to Dr. Lammert now.
Great. Thank you both, Dr. Montero and Aaron, for this excellent conversation, some really important points. So again, it's so important. These issues already affect so many of our patients with autoimmune liver disease, and we know that this is not only in adults. Importantly, we know this is equally important in the life in kids and those caregivers as well as their families. So we're going to transition now and focus on these underserved groups. It's my honor to introduce Christine Browner. Ms. Browner has been and remains a very strong advocate for the pediatric autoimmune liver disease research and education through a number of organizations. And as a parent to a son with autoimmune liver disease, she has seen firsthand the challenges that come with pediatric disease. Chris, thanks for joining us today and helping moderate this next session.
Thank you, Dr. Lammert, for the kind introduction, and thanks for you and the Autoimmune Hepatitis Association and Cincinnati Children's Center for Autoimmune Liver Disease for talking about this really important topic, mental health, especially during this pandemic. So thank you.
Great. Can I just ask you briefly before you get started, and with your expertise in your family's interests, what have been the hurdles you have seen after your son's diagnosis?
Yeah, really great question. So our 19-year-old, just for those of you that are listening, our 19-year-old son, now 19-year-old son, who is the middle of 5 kids, was diagnosed with primary sclerosing cholangitis, PSC, and autoimmune hepatitis at the age of 13. And like many of you who are listening, perhaps, my husband and I really dove into these diseases and wanted to learn as much as we can, particularly around pediatric autoimmune liver disease. And what we learned is that both PSC and AIH primarily affect adults. And so what we learned is the diagnostic criteria, the management guidelines, as well as the treatment or recommended therapies were all derived from studies done on adults. And yet, like all diseases, children have specific needs and specific issues that treatment should be tailored to. So to answer your question about the hurdles that our family faced, I guess the big one was that we kind of felt like these autoimmune liver diseases for children didn't have a home, so to speak, in the medical community. So almost 5 years ago, my husband, John, and I partnered with Cincinnati Children's to start the Center for Autoimmune Liver Disease. And CALLED, as it's referred to, is a center that focuses on improving the outcomes of kids with autoimmune liver disease through mainly education and research.
Gotcha. And again, that's great. And maybe you could just expand on the Center for Autoimmune Liver Disease. And how is this helping to fill the gaps that you've seen?
Yeah, so CALLED is involved in several initiatives that are focused on understanding pediatric autoimmune liver disease with the ultimate goal of slowing progression or actually finding treatments to prevent the onset of autoimmune liver disease. And so I think one of the unique things about CALLED is that it recognizes that children and adolescents, as well as their families, have unique issues and with regards to mental and physical health. So I know for many families and this is definitely true for ours. The psychological impact of having a chronic liver disease is actually been as debilitating as the actual physical symptoms of the disease. And so that's why I'm really excited that we're having this webinar and talking about that. Is this a good time for me to introduce Dr. Rich?
Sounds great. Thank you.
Okay, great. Well, I am just thrilled to be a part of this, and thank you for asking me to be the one to moderate this part with Dr. Rich. So Dr. Rich is a pediatric psychologist and assistant professor in the Division of Behavioral Medicine and Clinical Psychology at Cincinnati Children's Hospital. Dr. Rich specializes in providing clinical care to children, teenagers, and young adults with medical conditions whose treatment requires immunosuppression, including autoimmune hepatitis. Dr. Rich provides brief and long-term psychological and behavioral intervention to address various aspects of managing a chronic medical condition, including coping with occurring anxiety or mood disorders and managing medication. So Dr. Rich, thank you so much for taking the time to talk with us today and answering questions posted by some of our pediatric patients and their caregivers.
You're welcome. It's a great opportunity.
Yeah, good. Well, so we had some really good questions. I'm going to start with a few from parents, if that's okay. So one of our patient families asked, how do I know if I'm being overprotective or appropriately protective of my child during this time? And how can I reassure her that she will be okay?
This is a really tricky one, and I will say you're not alone. I think in this situation, I would really encourage parents to rely on the advice from their medical team. So the medical team is going to give really good guidance on what they think is most appropriate. And sometimes when we're dealing with anxiety, it can make us overreact or do more than is necessary. So if you kind of come back to saying, what is my child's physician and nurse team saying is okay for them to do and not do, and try to rely on that. If your child is worrying about this, that's also very normal. What I would recommend is having the parents share with their children all the ways that they're working to minimize risk. How they're staying away from people, social distancing, what they're doing to kind of clean their households and surfaces. Sometimes reassurance works for kids, and sometimes kids don't necessarily respond to reassurance. Some kids or teenagers who've already prone to maybe some anxiety or worry may not respond to that reassurance and may keep coming back with more and more questions. Am I going to be okay? What's going on? So in these situations, I encourage actually the parents to put it back on the kid or the teen and say, okay, let's list these out. What are the reasons? If the child can develop them themselves, they're more likely to trust and believe in that a little bit more. Sometimes parents would also find it helpful to set aside a specific worry time for their child or their teenager. So sort of anytime worry is coming up during the day, saying, okay, we're going to talk about that during worry time, you know, from 7 to 7:15. So let's save it till then. And that can sometimes minimize the amount of sort of rumination or thinking over and over and over about these things. I'd also encourage parents to tell their kids to do some things that make them relaxed. So when we have anxiety, it heightens up things in our body, like can make our heart race a little bit more. We can be anxious about what's going to happen. We may have difficulties breathing. So we want to do some things such as coaching them on how to take some slow, deep breaths. We can also talk to them about how to imagine a scene where they feel really calm and comfortable, and eliciting the 5 senses to do that. So for some people that may be out in the woods, and so you want to encourage them, what does the woods look like? What does it smell like? What does it sound like? What does it taste like even? And what does it feel like? And that can be another way of kind of calming their nervous system down. Since the mind and body are connected, if we can actually calm the physical aspects of stress in our body, that can almost trick or remind the brain to say, okay, everything's okay. We don't have to worry right now.
Those are great tips that can apply to me too as a mom, for sure, a lot of those. I love this question. I see this in my household with our 5 kids, but they're quite, some kids are quite angry about the lack of, the restrictions that are on them. They've had all this freedom, and then all of a sudden it's like, especially when they're home from college or whatever, it's less free than ever. So anger around not being able to see friends or boyfriends and girlfriends. And there's a lot of arguing going on in some houses. This is what this parent asked. And any tips on how to keep peace in the house?
Yeah, so I'm glad this one came up. This is totally normal, and in households where there are already teenagers, I imagine arguing was already a norm anyways. Something that I will definitely mention is that because of the developmental stage of kids and teenagers, a lot of them also have trouble wrapping their mind around why prevention is important. So I'm not sick, my friends aren't sick, why do I have to stay away from them? So I think as parents, understanding that the rationale and the reasoning that we know as adults to why social distancing is important, why we're trying to prevent the spread, is not always going to be as intuitive to our kids and teens. So sometimes that can also just help us empathize a little bit more with the emotions that they're experiencing. What I'll say is that for parents, validating the child's emotion can go a really long way. So letting them know, I can understand why you're angry about this. If I was a teen and this was happening, I'd be angry too. What that does is it goes a long way for them to know that you hear that, you understand that they're feeling angry, why they're feeling angry, and also it's going to make them more receptive or open to any suggestions that you might have for what they can do with that anger. So the validation is really key. You don't have to agree with their emotions, but letting them know that you can understand why they'd have that emotion in the first place is really important. The other thing I really like to point out to parents is that just because we're validating an emotion doesn't mean we have to validate or accept any behavior that's in response to that. So sometimes when kids and teens are angry, that can result in, door slamming, back talking, kinds of things that parents aren't necessarily wanting to have in response to the anger. So this is a really good time to help suggest for your kids or teens what they can do to manage their anger. So these may be things that you do yourself. Is that going to a room where nobody's at to take a break? Is that taking a walk outside around the house? Is that going and doing something distracting that can take their mind off of it and help diffuse the situation? Those are going to be important to say, it's okay you have this anger, but here's some things that you can do with the anger. And that may have less of a negative impact on the family. So what I also want to sort of give parents permission for is that even though we are in a pandemic, it's okay to set limits. So sometimes parents are in these situations where it's like, oh my gosh, this is terrible for my kids and my teen, and they're going through so much. But kids also need that structure and those limits. So if before the pandemic it wasn't okay to slam doors or stomp around the house, then it's still not okay to slam doors and stomp around the house. So it's okay for parents to validate the emotion, but also set some limits around how that emotion is expressed.
Great, thank you for that reminder that it's okay to set boundaries. That was helpful for me.
Yeah.
Okay, here's another question from one of our patient families. So this parent writes, I know all of the things that my teenage child is supposed to do to take care of himself. So psychologically, so get enough sleep, exercise, eat well, meditate. And she says that she encourages him to do all these things, but he refuses. She wants to know, does she keep pushing or does she lay off of him?
I wish there was a right or wrong answer for this. I think one thing that's also important to remember is this is a time where all of us, including teenagers, are looking for some control. And, these are things that they may have control over right now. So this could definitely be part of what's happening. But what I would really encourage parents to do is have a conversation with their kids and their teenagers. Do this at a time where both parties are feeling relatively calm, and just say, hey, I've noticed it's been hard for you to get to sleep on time, or it seems like you're not exercising as much as you normally are. Like, what's going on there? And see if you can figure out what may be getting in the way. Are they having a lack of motivation? Do they not know how they can exercise? Sort of finding out what's going on, because that's going to help you as a parent give them ideas or suggestions. So what I would really encourage parents to do is have a collaborative discussion with their teenager about this, and maybe start small. Pick the one that either feels most doable to the teenager or the one that maybe they're most motivated to do. So maybe that's exercise, and let's start there. Let's brainstorm a few things that we can do. This is also something that's important to model. So teenagers and parents and everybody is seeing each other way more than they're used to. So if you are encouraging your child to do all these things, they're going to take their cues from you. So we want you to do those things too, because it can feel, kind of like, why isn't mom or dad doing this if I have to do it? And then the other thing to think about is how can they maybe engage their friends in this? So if you know of some other teens that are having struggles with this, maybe the parents can help them get together, create a challenge, who can, get the most steps while they're, during the course of the day, or who can get the most hours of sleep. And that can also make them feel connected to their friends, and also use some kind of friendly competition. Also, for parents who are really concerned and say, well, for my child, I don't really think this is a choice. They really need to eat more regularly, or they need to get more sleep. You might want to use some external motivators. So when kids aren't necessarily motivated internally, they'd rather play video games or stay up late chatting with their friends, maybe say, okay, if you exercise this number of days, or if you get this number of hours for sleep per night, you can earn something. Maybe there's something from Amazon they've been trying to get. Maybe there's a privilege they've been wanting. So sometimes when we're not motivated internally, we can think about something that they're motivated to earn on the way to that.
Those are great practical tips. Thank you.
Mm-hmm.
Another patient family rights, a parent. I'm very concerned about the health of my child during this crisis. I think that's a common theme with a lot of our patient families. My friends and family think I'm overreacting, and they're minimizing my concerns. This writer feels judged and unsupported, and is looking for any suggestions on how to talk to them.
Yeah, and I can certainly understand those feelings in that situation. It's hard enough trying to deal with your own uncertainty or your own emotions around this, but then feeling unsupported is a real struggle. So, I think something that can be really beneficial in this situation is using some assertive communication. So a lot of times when we're feeling judged or unsupported, we either respond in a way that's kind of driven from anger, we yell, we're upset with the person, or we go on the other extreme, which is we don't say anything at all. And then those negative feelings, that anger, that judgment kind of builds up and can create some own stress. So assertive communication is a style that's somewhere in the middle. So it's putting your emotional reaction, your needs out there in a way that's most likely to be productive. So there's an acronym that comes from a type of therapy called DBT that's called DEAR, D-E-A-R. I'll just briefly describe those steps for you. The first is actually called describe. So this is where you want to let the person know what you're reacting to. So over the course of a day, a family member could have done, 10 things that could elicit an emotion for you. But you want to say, when you told me you think I'm overreacting. So really lay out the facts. What is it that you're reacting to? What did they do that upset you or hurt you? The E stands for express. So this is where you want to point out what emotions you were feeling. So I felt unsupported. I felt frustrated. I felt hurt. Whatever those are. Sometimes we think that people know how we feel or they can read our minds, but that's not always true. So we really want to be explicit in how they affected us. The A step stands for assert. So this can be hard for a lot of people, but this is where we actually want to put out there what we'd like the person to do. So is this, I'd like you to not share your opinions with me. I'd like you to just agree with the decisions I've made. Whatever they can do for you that would make you feel better, and putting that out there. And then R stands for reinforce. So what this means is sort of a wrap-up statement to say, and if you're able to do this, it would really ease my stress. Or if you were able to do this, it would really make me feel better. And taking those steps and doing it in a very neutral tone can really go a long way. Of course, the person is their own person and they will decide if they're going to do what you've asked them, but at least you've put it out there. And we find that a strategy like this can really increase the likelihood that somebody is going to respond to us without defensiveness and be more open to that. You may even want to write it out or practice before you do it.
Great. That's a hard
and the one other
conversation
point I'll make is obviously there are some family members that we may need to interact with, but in a situation like this, I think it's okay to exert some control and say, you know, just focus on the ones that are being more supportive. You know, use those people for your outlets, reach out to them. You know, as the pandemic sort of passes, you can you reach back out, but it's okay in this situation to take things that are within your control, and that's you know, certain family members.
That's a great reminder. You don't have to be talking to everybody or getting advice from everybody, I guess, during this time.
Yep.
Good advice. Okay, we have one more question from a parent and then a couple from pediatric patients themselves. So the last question that a parent wanted to know is, he or she writes, if I think my child could benefit from virtual therapy, what options are open to me? And are there other resources online that would be helpful?
Yeah. So this is going to depend some on where you live. So states have different rules in terms of what psychologists can do for telehealth, who can practice across state lines. So what I would recommend in this situation is reaching out to your child's pediatrician or local children's hospital or GI provider. They usually have a resource list of pediatric psychologists or therapists in the area, and then reaching out to them to say, are you providing telehealth at this time, would probably be the best option. There are also some websites, and I can make these available or send those to whoever has the power to distribute those widely. Actually, our psychology group, our developmental and behavioral pediatrics group, and our psychiatry group at Cincinnati Children's put together some really awesome websites with a bunch of different resources for coping and ideas. So I think that's going to be helpful. The Child Mind Institute is another very reputable organization that has a bunch of materials online. So that would be another one. And then there are resources available on Amazon. So there are a bunch of different workbooks that are designed for kids and families to do themselves. So for younger kids, I like one called What to Do When You Worry Too Much. This is based in cognitive behavioral therapy, which we know is an evidence-based treatment. And then there's one called the Stress Reduction Workbook for Teens. And they're really kind of simple to work through and can have some just really beneficial kind of things to think through, exercises that people can do kind of on their own time.
Great. And I think we'd love some of those resources and we can maybe make those available to our patient families. I think that would be really helpful.
Yeah, I think that'd be great.
Great, thank you. Okay, from some pediatric patients. So one says, I'm concerned that a family member's behavior might be putting me at risk. I think this is really interesting. And they're talking about a sibling, an older sibling specifically. And this patient is wondering how she should talk to him about his behaviors.
Well, first of all, I was like super impressed to see that some patients themselves submitted questions. So kudos to you guys. So this is very challenging, particularly when we know that we don't have a lot of control over other people. So similar to the assertive communication that I talked about, I think this is important for the patients as well. So I'm not sure the age of this patient, but the DEAR could be an appropriate response. Sometimes for kids or teens, something a little bit more simple called I feel statements. So this is going to be a way to let the person know why and how this is impacting you. So, you know, I feel nervous when you, for example, come back home and don't wash your hands thoroughly. I would like you to. I would like you to wash your hands for 20 seconds every time you come back in the door. Putting it out there, exactly what you'd like the person to do is sometimes what you have in your control. I'm not sure if this patient has spoken with adults or parents in the home. This may be something that needs to be escalated up higher, and perhaps the parents or adults have some say in it. But I think it's important to empower yourself to let that sibling know exactly how you feel. They may not know. They might not be able to read your mind. So I would start there.
Great suggestion. Okay, full disclosure, this came from my son, this next question. My parents are being way too overprotective of me, especially now. How do I tell them to lay off?
Well,
I think he told me by asking that question. But.
Yeah, exactly. That was his way. And I would tell him, I think it's important for teenagers who are in this situation to have that conversation with your parents. Sit them down at a time when there's no distractions, when people are feeling relatively calm, and let them know how you're feeling. How is this affecting your life? And it may be a situation where they don't quite realize how it's affecting your life or what impact it's having. And I think I would encourage teens to also allow your parents to explain their perspective. There may be things that you're not aware of that they know about that are impacting their decisions on what they want you to do or what they don't want you to do. And then I would say, see if there's any room for negotiation. You know, put it out there. What are things that you'd like to do? What do you feel like is too much? And then this can be a back and forth conversation. You know, practice maybe being a lawyer or something. Just ask for things and then, you know, see what's willing. Maybe there's something that they are willing to let you do, but since you haven't asked, they just are not knowing that's important to you. So I'd say speak up.
Great idea. Well,
and,
at that,
and use your friends. Complain to your friends. They're probably,
sure.
They can empathize with you.
Or siblings in my case.
Yeah,
We've got a lot of kids. Okay, well, thank you, Dr. Rich, and also thank you to Dr. Montero for sharing all your expertise with us. Those are really useful tools that are helping us manage not just during this pandemic, but just with kids and families during that have chronic liver disease. So thank you very much. Dr. Lammert, I think it's back to you.
Great. Thank you all. And I want to end this webinar with just a few final remarks. Again, many thanks to all our presenters today, Dr. Ermel, Dr. Montero, Dr. Rich. Thank you to our moderators as well, Christine Browner and Aaron Anderson. I think our conversations today really shine a new light on a very under-recognized concern of autoimmune liver disease patients and even their parents. We hope that you could even just take a few of these pieces away from this webinar today. And maybe we've helped to demystify some of these symptoms as well, that we know can dramatically reduce quality of life, especially during a pandemic such as this. We would encourage you that if any of these symptoms we discussed today are a problem, you need to speak up to your doctor and advocate for yourself, but also maybe even advocate for your suffering family member as well. Don't wait. We will return again in 2 weeks with our next webinar edition. In the meantime, keep distant and safe. Thanks a lot.